tooth survival after surgical or non-surgical endodontic retreatment, long-term follow-up of randomized clinical trial. This paper published in JOE by Andreas et al. As we know, the aim of root canal treatment is to prevent the periapical disease in order to promote long-term tooth survival. However, Inc. et al. 2008, they suggest that in case of post-treatment disease, tooth-preserving treatment options include surgical and non-surgical endodontic retreatment. So this clinical study examined long-term tooth survival in randomized surgical versus non-surgical on 10-year survival rate and on way retreated teeth might be extracted. However, the aim of this study to compare the long-term tooth survival after surgical or non-surgical endodontic retreatment and to investigate the presence of intraradicular both influence the outcome. So in this study include 92 patients for endodontic retreatment because of post-treatment disease. The inclusion criteria: incisor in which apical radiolucence was present in the X-rays, the presence of clinical sign and symptom, and the patient consent was obtained. In all 95 teeth were randomized according to the three factors: the size of periapical lesion, and the apical position of root filling, and the quality of root filling for either surgical or non-surgical retreatment. As we can see in the table 1, it shows the follow diagram of the study based on intraradicular both were present in 39 teeth, which is 83% in the surgical group, and 37, which is 77% on the non-surgical group. All treatment procedures, surgical and non-surgical, were performed by single operator. The follow-up period ranging from several years to assess the tooth survival. The data on clinical outcome, radiographic healing, and patient-reported symptoms are typically collected. The outcome measure tooth survival and the success rate based on the radiographic healing. The result of this study: the follow-up time was 10 years and the overall survival rate was 76% with no significant difference in long-term tooth survival between retreatment method and the reason of tooth extracted were related to the retreatment method, and vertical root fracture were significant more frequent in the non-surgical group when retreatment including post-removal. The conclusion of this study: there was no significant difference in long-term tooth survival after surgical or non-surgical retreatment, and the presence of intraradicular both did not affect the long-term tooth survival. But for the teeth with both, those related to the non-surgical were more frequently extracted because of vertical root fracture than those retreated surgically. Thank you.